Carry simply. As a part of our August worship, we are engaging in some lectures, discussions on topics pertinent to us. And this morning, in place of the sermon, we will have a presentation by one of our own, young Dr. Rochelle Morris. She'll be speaking to us on hypertension, something that I think we all need to pay attention to as we go about our daily duties, as we eat the things we love to eat that perhaps we should not be eating, in the quantities that we should not consume. And so I now invite Dr. Rochelle Morris to give us a talk on hypertension.
Good morning, everybody. I'm Dr. Morris. This morning we're going to have a lecture on hypertension. It's going to be a very interactive session, so I just want you guys to stop me at any point during the lecture to ask any questions, make any comments. That's quite fine. So it's going to be look at healthy living. So just first of all, just look at scripture that I came across while preparing for this lecture. And it's in James chapter 5, verses 14 to 15. And it says, "Is any sick among you? Let him call for the elders of the church, and let them pray over him, anointing him with oil in the name of the Lord. And the prayer of faith shall save the sick, and the Lord shall raise him up. And if he hath been forgiven sins, they shall be forgiven. So just need to bear that in mind when we come across any illness, whether or not it's hypertension, diabetes, you're diagnosed with a terminal illness, you can go to the elders of the church, you can go to God for anything. So first of all, what exactly is blood pressure? Because that's what the topic is going to be. Basically looking at what high blood pressure is. So first of all, looking to see what your blood pressure is. And first of all, let me see if I can explain clearly what blood pressure is. So basically, the heart is a pump. And from that pump, there are many pipes going to different parts of the body. So these pipes are going to the brain, going to the kidneys, going to the lungs, going to everywhere, the heart included. And basically, the heart pumps, and when it contracts, it forces blood from the heart to go through these pipes to the different parts of the body. And when it contracts, it produces a pressure. And that pressure is actually at its maximum, and that's what we call the top part of the blood pressure, known as the systolic pressure. And usually for somebody, in a normal person, and a normal blood pressure, the top systolic number should be about 120 millimeters of mercury. And when the heart relaxes, because the heart is not very static, it is actually moving. And funny enough, the heart doesn't just contract like that, it rotates as well. So when it relaxes, it produces a pressure as well, but not as high as the one from when it contracts. So when it relaxes, it produces a pressure that is lower. And in somebody who's normal, an average blood pressure that's normal is in the bottom, which is the diastolic pressure, is 80 millimeters of mercury. And that is how we get our blood pressure. Now, in instances where your blood pressure, your blood pressure doesn't stay normal, whenever we do activities, for example, when I came to do this lecture, I was a little nervous that my blood pressure went up a little bit. So that's quite normal. But when it is persistently high, that's when the blood pressure is not normal. And then you have to think about whether or not you may be at risk for developing hypertension. Now, the normal blood pressure is, sorry, I have some technical difficulties. So the normal blood pressure is usually less than 120 on 80 millimeters of mercury. Right, so when that blood pressure moves from 120 and it goes up, and it stays persistently high, you're at risk for having hypertension. And this here just basically shows a thermometer which shows how your blood pressure can actually go up. So if it's below 120 on 80, that's actually an optimal blood pressure. But when it starts to go up, it's a little worse. And you start to go to a point where you become what they define as pre-hypertensive. So the blood pressure starts to go somewhere between 130 to 139 on 85 to 89 millimeters of mercury. Right, so usually, what are your blood pressure targets? Because that's something that you guys will probably be asking. What should my blood pressure be like? Sometimes it's actually hard to get an optimal blood pressure, and almost impossible sometimes to have a blood pressure of 120, 180. And therefore, there were actually developments towards what the pressure target should be. And this here shows, so if you're under 80 years old, we actually allow you to have a blood pressure less than 140 on 90 millimeters of mercury. But the older you get, the more changes occur, and they actually start to have some changes occurring within those pipes that take the blood from the pump, which is the heart. So within the pipes are actually the arteries of your body, which actually takes blood from the heart to go to different parts of the body. So those arteries actually change the older you get. You get plaques building up, and you get calcium building up within those arteries, and that actually contributes to your blood pressure going up. So the older you get, we actually allow you to have higher blood pressure. So 150 to 90 millimeters of mercury. However, if you are diabetic, your blood pressure, unfortunately, should be lower. And why is that? And that's because diabetes alone makes you at risk for having things like strokes, heart attacks, and if you have high blood pressure on top of that, that increases your risk to almost eightfold. So imagine you just have high blood pressure, that's fine. But if you have diabetes on top of that, it increases your risk for having all these things. So therefore, anybody who has diabetes should have a target in your blood pressure. So I actually have their greater than 135, so that's going to be less than 135 on till 140 on 75 to 80 millimeters of mercury. Any questions at this point in time? Anybody? Understand? Okay, great. Right, so now the definition of hypertension or high blood pressure. So people may think, you go to the doctor, you're excited, you have a rash on your skin, you're so worried about, you go to the doctor, the nurse takes the blood pressure outside, and it's 140 on 80 millimeters. I think I have high blood pressure. You freak out and everything. Then you sit down, you calm down, nurse says, okay, let me take the blood pressure again. Again, it's 140 on 80 because you're worried, you're seeing, oh my goodness, I have this rash on my hand, I don't know if it's going to be here forever. How am I going to walk around at work without people scorning me, etc. So, you need to have at least 2 or more persistently high blood pressures, grades above the target for your age, to actually be diagnosed with hypertension. And that's important. So, but more importantly, and I want you guys, if anything else that you take home from this lecture today is, once you have a diagnosis of hypertension, it is a lifetime risk. Everybody understands that? No, because I need to understand it the first thing. So, what do you mean by it's a lifetime risk? Meaning, if your doctor diagnoses you with hypertension, that doesn't necessarily mean that you're going to have hypertension for life. You may, or you may not. But once you're diagnosed, it means that you are at risk for developing heart disease, you're at risk for developing strokes, you're at risk for developing heart attacks, all these things. So, therefore, if your doctor starts you on medication for hypertension, you never, ever stop on your own. So, I want you to take in those 2 points. 1, it's a lifetime risk, and 2, if you are diagnosed, you cannot stop taking your medication on your own. I know some people are feeling a little guilty, but that's okay. So, why do I say that? I'll let you know as I go on. So, what are the risk factors for hypertension? And I put this point specifically first, obesity, because our population, I did not say that. Right, so our population, majority of us are actually overweight, and we really need to do something about it. And even being African American or Black actually puts you at risk for having hypertension as well. So obesity and being Black, so we're at risk. So the next thing is decreased activity or inactivity. You get up in the morning, you go, you sit down behind a desk, you type. The only thing you're doing is using your fingers, using your mouth. You go on the phone, you say, yes, boss, I have this report handing, I know in a couple of days, but you need to give me a little more time. And you go home, you go and cook when you get home. You go lie down for a few minutes, watch a little TV, watch the evening news, all that stuff, and you do nothing else. Every single day, the same thing. The other thing is smoking. And it's actually tobacco in the smoke that actually causes damage to your arteries, that actually puts you at risk for having hypertension. And that is something that you have to realize. It's not actually the smoking itself. It's what the tobacco, how toxic it is to your arteries. And remember I said before, the arteries play a major role in taking blood from the heart to the different organs in the body. So if those are damaged, then the heart also feels the effects. And then people say, this is a big thing. Everybody's thinking, I am not under stress, so I am not at risk for hypertension. Or, I am under so much stress, oh my goodness, I am surely going to get hypertension. It is not a cause. It is just a contributor or a risk factor. Along with other things, it can cause high blood pressure. But yes, stress is a contributor to developing hypertension. And then, one that a lot of people whinge about is alcohol consumption. And it's not just, every day you have a glass of wine, red wine, after you use your dinner. That's fine. But, drinking heavy. So alcohol consumption is also a risk factor. And of course, binge drinking is actually one of the major things that can actually cause or is a risk factor for hypertension. And age. So all those things that I listed before are actually modifiable risk factors, meaning that you can do something about it. And this is why I'm talking to you guys today, so that we can do something about it, so we can prevent it. And if you do have it, try to reverse it as much as possible. Age. Unfortunately, every single minute, every single hour, we are aging, and that's nothing that we can't do anything about that. So the older you get, the more risk you have, you're at risk for hypertension, and that's because of what I said before about the arteries. The arteries start to age as well, and you're at risk for hypertension. And then another risk factor that we cannot change is if we have a family history of hypertension. It may just be your genes, you inherit those genes, and you develop hypertension. Then there are causes as well that you cannot control. So you develop kidney disease. One of the things that is actually quite common in our society, which I didn't even know about until recently, is something called adult polycystic kidney disease. So basically you have cysts on your kidneys, and that can actually put you at a risk for having hypertension. And it's actually passed on from generation to generation. And some people may not even know that they have it, but you just have every single person in your family having hypertension. And there may actually be an actual cause for that. And that may be kidney disease. Oral contraceptive pill is also a risk factor or cause for hypertension. And then other drugs, for example, your non-steroidal anti-inflammatories. And I know a lot of people here use that for pain control. So you have your little arthritis, and the doctor says, okay, here's some Cataflam, this works well, or some Voltaren, this works great. Yes, you can use them, but you have to use them in moderation, or else you put yourself at risk for having high blood pressure. And then endocrine disorders and tumors, which you may never hear about or ever come across. I'm not going to mention anything about them until sleep disorders, which is also associated with obesity. So one of them is obstructive sleep apnea. I'm not going to go into details because that's not what we're here to talk about. And then heart disease. One of the heart diseases that children actually develop. It's called coarctation of the aorta. If you have that, then that's something that can actually be surgically fixed and you can reverse the high blood pressure. So, meat of the matter, what is the treatment of hypertension? I'm not going to talk about any drugs, but I'm going to talk about the treatment that you can do something about, because the drugs you are going to be able to come across if you are diagnosed and your doctor says, yes, you have to start a particular drug, etc. So we're basically talking about things that we can modify. So the first two things are lifestyle changes. So the two things, diet and exercise. Two simple words, but so complex that we can stick to diet and exercise. I went on vacation 2 weeks ago and I said, I am going to lose 5 pounds. I thought it was very, very ambitious. And I said, I can do this. I'm going to wake up every morning, I'm going to walk, I'm going to start walking, and then from walking to running. And then I'm going to start dieting because, I'm at home, I can blend all you're not going to work, so you don't have to worry about stopping off at KFC and shit. But no, it's possible. And guess what? I didn't stick to my plan. That's the truth. So I did not diet, and I minimally exercised. So I ran probably like 3 days out of the 2 weeks that I was on vacation. Sad. So dieting and exercising is actually quite important for the treatment of hypertension. And today I'm trying to convince you guys to diet and exercise, not only to prevent hypertension, but also to help with controlling your hypertension as well if you actually have a diagnosis of hypertension. So, the 3 things that I want you to be able to do is to reduce your sodium intake, use alcohol in moderation. I see Father Roger shaking his head. Sodium intake, okay, alright? Very good. Decrease caffeine intake. So I know every day some of you guys wake up and you have to have a cup of coffee, or you drink Coke every day. It's mad, it's crazy. I'm selling no Father Rogers. So the next thing is exercise. Exercise. We're gonna come a little later to that in terms of how you should do exercise. And then of course you're gonna ask me, are there any alternative treatments besides the medications that my doctor is giving me? Is there anything that I can use instead of my blood pressure medications? And the answer is no. There is nothing, absolutely nothing. And I'm not just rapping for some pharmaceutical company saying, yes, go take these blood pressure medications, put all your money in the pockets of the pharmaceutical companies. No, I'm not saying that. I am just saying there's nothing that can substitute what your doctor gives you for your blood pressure. But there are things available to help decrease your blood pressure, to assist with that blood pressure medication to decrease your blood pressure. So these things include garlic tea. So you boil a little garlic and you drink it. That can actually decrease your blood pressure by 2 to 3 millimeters of mercury. Yay! So you drink that every day, hopefully you're targeting to getting that blood pressure down more and more and more. And then there are the fish oils, the omega-3 fatty acids, there's hibiscus tea, they say cocoa and chocolate extract, but not chocolate, no, not chocolate, the dairy, no, the extract. And then magnesium, vitamin D were also shown to decrease your blood pressure. And then your green coffee extract as well. So, this lecture is again to focus on lifestyle change. I'm just going to bring up another scripture that Paul spoke to the church in Romans about. It is in Romans chapter 12, verse 2. Do not be conformed to this world, but be transformed by the renewal of your mind, that by testing you may discern what is the will of God, what is good and acceptable and perfect. I'm going to say that again. Do not be conformed to this world, but be transformed by the renewal of your mind, that by testing you may discern what is the will of God, what is good and acceptable and perfect. Write it down. Romans chapter 12, verse 2. Because this is what will be your motivation to change. So lifestyle change. So you have a goal ahead of you. So your goal is do not develop high blood pressure. If you can, control that. Or if you do have hypertension, we're going to actually get your blood pressure to normal so that actually decreases your risk of getting a stroke, a heart attack, all these things that will or potentially change your life forever. So behavioral change, so your mind, renew your mind, keep Romans chapter 12 on your heart for behavior, that mind. So you renew your mind first, and then you can do psychologically, psych up yourself. Yes, I am not going to diet to lose weight. I am going to diet for lifestyle change, to be healthy, to stay young, to be able to support my children, to be able to support my husband or my wife, and, just be happy. And physically, actually doing the exercise. So what should your diet be like? Father Roger is saying, so it needs to be rich in fruits and vegetables, low in salt, low in meat, low fat dairy products, low in bad cholesterol, because there's good and there's bad cholesterol. Remember earlier we were talking about using the fish oils for the treatment of hypertension. That's the good cholesterol. But you want to avoid the bad cholesterol that you get when you go and you see that big purple and yellow building that you pass on every single corner. And you say, can I have, what's the special now? Big thing? Yeah, I'm gonna have it. Right? And then it also needs to be high in fiber. So it's not just a diet, it's a lifestyle change. So this is something that the doctor would people mentioned to you about, but this is something that was developed a few years ago called the DASH diet. So it's actually a diet that helps or is actually proven to lower your blood pressure and your cholesterol without medication. Imagine that. So what you put in is what you get out. So what you eat, is what you produce. So if you eat a lot of fat, you're going to put on fat. If you eat less fat, you lose fat. So the DASH diet actually looked at a diet which had calories of only about 1,200 calories. And the sodium within that diet was somewhere between 1,500 to 2,300 milligrams of salt, okay, or sodium. And it looked at using more cooked grains, more vegetables, more fruit, dairy, but it has to be low fat or free of fat. I don't really promote the free of fat because the more fat you extract from dairy, the more sugar you get. And that sugar actually is stored, and when it's stored as fat. So I promote more lower fat dairy. And then your lean meats, which are mainly your fish and your chicken. So if you think that if you want to change, you're going to be going into the market and picking up that red stuff, it's not going to work. So it needs to be lean meat, fish, and chicken. And then nuts and seeds actually provide you with the omega-3 oils that I was talking about, the good cholesterol. And then obviously oils and less oil and less sweets and less sodium. That's why those things are at the bottom, because those are supposed to be less. So 1 tablespoon of oil per day, 1 teaspoon of sugar per day, and the sodium, 1,500 to 2,300 milligrams. Do you guys see this slide? Can everybody see it? In the back, can you see it? You guys can stand in it. Yeah, perfect. Exercise, 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 and more exercise. I will not instill it anymore. You need to exercise. So you don't need to join one workouts to make this thing happen, You don't need to be like my colleagues, Dr. So these are the people that run workouts. You don't need to be like my colleague, Dr. Garth McIntyre. He's the OBGYN. I don't know if some of you guys know him. And then, like my colleague, he's my age, and he can run a 2K in no time. He embarrasses me. He says, Roach, when are you gonna come and run with me? So we can, lose that weight that you keep talking about for the past, I don't know how long. So that's Dr. St. John. Run Barbados. So you don't need to be like those guys, taking part in Run Barbados to lose weight. So, look at this carefully. If you have time to watch TV and surf the net, you have time to exercise. There is no excuse. None. Stop being lazy. It's only 1 hour a day. And you don't even need to, it doesn't necessarily need to be 1 hour. So the exercise recommendations are just at least 30 minutes, 3 to 4 times per week. If you want to lose weight 4 times per week, and you absolutely need to sweat. So it's not, come, let's go and exercise. And you walking, and you talking, you gossiping, and you walking, and you thinking, yeah, I'm exercising. It is not like that. You need to sweat. So first walk, jog, or run. And more importantly, you need to be consistent. So it's not like me who said every day I'm going to wake up and I'm going to go and exercise. I'm only do it 3 days out of the 14 days. No, it's not going to work. You need to be consistent. So after you have done all these things, so you diet and you exercise, you say, yes, I am on target, I am on goal, I am achieving that goal. I have renewed my mind, I have changed my behavior, I have started exercising, I'm losing weight. You need to follow up with your doctor. So you need to continue to follow up with your doctor. You're not going to do this on your own. So you need to make sure you go to your doctor visits. So your doctor visits will be probably every 3 to 6 months if you're initially, every 3 months if you're initially diagnosed. And then probably every 6 months if your blood pressure is actually to target of what your doctor wants it to be. And do not miss taking your medications. I am not going to insist that anymore. And ensure as well that your doctor gives you urine checkups. Because as I said before, your blood pressure actually not only involves your heart, but it also involves majority of all the organs in your body. So your brain, your heart is also involved, your kidneys are involved as well. So yearly you should get kidney blood test done, so kidney function blood test done, as well as checking your cholesterol, because your cholesterol along with your hypertension is what is going to put you at the risk of developing the heart attack and the stroke. And as well, you need to have what we call a heart test, the electrocardiogram, which essentially checks not only the rhythm of the heart, but it can tell you a lot of things from actually just looking at the electrical activity of the heart. And it tells you a lot. And it can actually tell you if your heart is starting to develop damage from high blood pressure. And I see a lot on the TV where they say hypertension is a silent killer. And it really is. It's a silent killer. Why? Because you go around, you walk around, you feel healthy, you feel well, you do not feel ill at all. Then you go to your doctor for routine checkup, and he checks your blood pressure, and he says your blood pressure is 200 on 110. That's a crazy number, but it can happen. 200 on 110 millimeters of mercury. That instantaneously puts you at risk for developing a stroke. And you were walking around feeling fine with that blood pressure. And only the Lord knows how long you've been walking around with that blood pressure. And if that's the case, then fathers, you're going to need to go to your doctor or your routine checkup just to make sure blood pressure is over 210. So that's what you need to do. And if your if your blood pressure is actually coming down. And you also need to make sure it's not coming down too quickly. Because if it is, that also puts you at risk for developing a stroke. Right? And I forgot to mention, if you stop taking your blood pressure medications instantaneously, that puts you at a 1% risk of developing a stroke. And you do not want that. Strokes are things that not only affects the person, but it can affect an entire family, especially if a family depends on that person. So do not take feeling well for granted. Hypertension is a silent killer. So body complications, I kept mentioning them over and over again. So strokes, heart disease, and heart disease is not just you having a heart attack, but heart disease is also developing changes within the actual muscle and size of the heart. So hypertension can actually cause your heart muscle to get thicker. So imagine, I will have many biceps, but I'm just going to use that as an example, right? So imagine, right, I want to get buff, you know, I want to enter Mrs. Fitness for babies. And I said, yes, I'm going to go to the gym and lift some weights. So this muscle right here, my biceps, I want those to look great. So every day I get up and I pull it up. Yeah. Muscles getting bigger. Essentially, after a while, as my muscle overworks, as it is overused, it will get bigger. And essentially that's what happens with hypertension. When you overwork your heart with your blood pressure being extremely high, the muscle of the heart starts to get bigger as well. So that then prevents the heart muscle from working as well as it should. So then you can develop something called heart failure. And it doesn't necessarily mean that the heart has failed. It just means the heart is not pumping as well as it should and doing the essential things that it should. And the other thing is kidney disease. So a lot of people, again, they walk around with high blood pressure, and the blood pressure actually starts to not only affect your heart, but it can also affect your kidneys. And when it affects your kidneys, sometimes you don't even know. And then your kidneys cannot tolerate that high pressure coming to it, and then the structure of the kidney starts to change, and then the kidney does not work as well as it should. And that's another reason why I say you should also get yearly kidney function testing when you are diagnosed with hypertension. And imagine, the eyes are also affected from hypertension. You see a hand? Yes, sir. Can you just state your name?
That's the word. My name. What I noticed in many drugs, I observe that women and men exercise every day in Barbados. When they go home, they go to the restaurant, fast food, chicken, Kentucky, chicken. And the most important for me is that I would like to purchase. Everybody here this afternoon or this morning that go home and have macaroni pie. That is very diet. It also has so much fat in it. Let me explain to you. I have a degree in psychology. And I watch all the women walk around the parks. And when they go home, I observe that they eating saturated fat. They want all the pies. Every restaurant in fast food in Barbados is not going pie. And I beg you, please, you can tell you, I'm asking you, at 70 plus, that's my age, I reduce my intake chicken, fried chicken, especially, and macaroni pies. Thank you.
Thank you for that comment, because that's true. I actually forgot to mention macaroni pie. Yes, my daughters, macaroni pie has a lot of fat. It is terrible. So thank you so much, sir, because I also forgot to mention something. So yes, you're exercising and you're doing what you need to do. But you need to bear in mind that when it comes to weight loss and actually getting results, you need to diet. It is 70% of your results. So if you do not diet and you just exercise, that is only 30%. And then you're thinking, oh my goodness, I'm working out every single day and I'm seeing no result. That's because you are putting in only 30% of the work. So yes, that's the end of the lecture. I see some hands over here.
Good morning.
Good morning.
2 questions. You mentioned about being overweight. Is there a comfortable gauge, proportion even, weight to age? And 2, I'm told that the systolic part of the pressure should be not more than twice your age. How is that? How true is that?
Okay, thank you, sir. I will try to answer these questions as specific. No, the first question, can you repeat that one for me again?
You mentioned about being overweight. Is there a comfortable gauge or proportion weight to age?
Okay, so you're talking about targets. Yes, there is a particular weight for your age, and also your height is also involved in that as well. So you can't just, me and my sister, suppose we were twin, and we're the same age but different height, we do not have the same target for our weight. So it's different. So it's different for your age, your height, and your weight. And they actually use something called your body mass index, your BMI. And your BMI is targeted somewhere around 18 to 24. So if it starts to get over 24, then you start to go into the overweight, then obese, then morbid obesity. Right? So yes. Now the second question is a little more difficult and complex. Can you just repeat it one more time so that everybody can hear?
I'm told the systolic part of the pressure should not be more than twice your age. How true is that?
Now, as I said before, remember, we don't usually use targets of age alone. You also use other targets as well. So I would say if I am 80 years old, my blood pressure has to be around twice as much, which is around 60. It's not necessarily like that. I don't know how the panel from we call it something called the NICE guidelines, or different guidelines. I'm not entirely sure how they came up with it, but they did studies, and these studies were relating to what were the complications associated with hypertension to actually come up with these targets. So they said, if you're 80 years old, what is your risk of developing a stroke from having a blood pressure of such? And they used those and what the results were to come up with what your target blood pressure should be for your age. So remember I was saying before, if you're under 80 years old, your target blood pressure should be less than 140 or 80. And if you're over 80 years old, it can be a little higher. So 140 to about 150 on 70 to about 89 millimeters of mercury.
What role do you see the church play in helping people adjust things like how can we?
I think St. Luke's has already started helping. So when you dancing, I think we actually had exercise classes. So we're actually doing something. So we just need to continue doing that. But, as I said before, that's only 30%. So, next time we have an event, Father Rogers, we need not to see the macaroni pie and milk, the potato salad, the coleslaw, all those things. So, yeah, fish cakes. No, that's a no-no. Okay, so maybe in moderation, but not too many fish cakes. So, if you're gonna have the fish cakes at church, don't have them at home. Or if you're gonna have them at home, don't have them at church. So maybe no fish cakes. Sorry.
Morning. Thank you very much, Librarian, for that. It's very informative. The two areas in which I'd like to have your comments. One is on deep breathing and meditation exercises for detoxification of body and for relaxation. And also on the critical importance of sleep, adequate rest, and deep sleep.
Very good. Thank you for that. And that's something that I actually forgot to mention in the lecture. Meditation. Meditation is actually very, very, very important when it comes to relieving stress. And as I said, stress is a contributor to hypertension. So if you can do every day a little bit of meditation before you actually go to sleep, and with meditation you actually get your blood pressure down, and you decrease your risk of having hypertension. So great, yes, need to meditate.
You spoke about the amount of salt that you could take daily. It is difficult to visualize the amount that you take. So can you, just perhaps looking at a teaspoon or something, give us an idea as to how much salt is that?
To be honest, I really do not know how much a pinch of salt is when it comes to milligrams. Or I do not know how much this is in terms of milligrams, because it kind of don't have a weight. But if you want to gauge or decipher how much salt or sodium you're taking in your diet, every single package that you use at home, you need to look at. So there's the back, the nutritional facts. It has how much sodium is in there. So as I said earlier, it needs to only be between 1,500 to 2,300 milligrams of sodium per day. So you need to add that up. And then I will start to advise you to reduce the amount of iodized salt that you actually put in your meals. So try to cut that out.
Thank you.
I thought iodized salt was supposed to be good.
It's good. For the ID. So if you're going to use salt, it should be iodized salt, because there's no other way that we get iodine in our diet except through iodized salt. So yes, I'm not saying cut out the salt altogether. There is a limit. You can use some, but you need to know what your limits are. These salt substitutes, they actually do not work. That's probably something that you actually have to look at the nutrition facts for. I wish I had a registered dietitian here with me to assist me with these questions. But thank you nonetheless.
Can you explain crack? Can you explain crack?
Okay, so what is a plaque? Alright, so plaques are actually a little complex to explain, but I'll try my best. So when you use those saturated fats, so you go to KFC, you go to Chefette, you eat some nice juicy chicken, your body starts to break down the fat within that. Some of the fat actually becomes stored, and that's for good purposes, because in the event that you start to starve yourself, it breaks down that fat to utilize as energy. But if you use more fat than your body requires, it starts a process where it starts to become laid down in your arteries. And when that happens, it forms this little ball, just like how, if you ate something and you didn't brush your teeth for 4 days, and you start to see that yellow build up, similarly, that happens in your arteries, where the plaque starts to build up in the arteries. Now, the thing is, plaques are extremely bad, unfortunately, but it's something that we cannot avoid because it happens with us the older we get plaques. Now, when does the plaque become bad? Now, fortunately, we can actually monitor or say, you are the person who is at risk for having a lot of plaques in your arteries. And we do that by monitoring your cholesterol levels. So we look at the good cholesterol and the bad cholesterol and your total cholesterol level. And then other parts which involve your cholesterol as well, called lipids. Now, if your normal cholesterol is supposed to be less than about 3, the total. If your cholesterol is about 10, your total cholesterol is about 10, and bad cholesterol is somewhere between 7, which is supposed to be less than 2, 2.5 to 4, but less than 2 for people who are at risk for developing strokes, and less than 1.8 for people who are at risk for developing heart attacks. That bad cholesterol is the thing that we decide for saying, yes, you are at risk for having plaques. So if you go to your doctor, you let your doctor know you want to get your cholesterol checked, and you can actually decide whether or not you are at risk for developing plaques, or you may already have plaques. And strangely enough, the plaques, the cholesterol or the lipids don't only deposit as plaques in your arteries, it can also deposit under your skin, so you can see it. You can deposit under the skin of the eyes over here, so you can look at somebody and actually tell that they have high cholesterol from these little deposits under the skin. And then there's also a ring that also develops around that colored part of your eye. It can actually tell you that your cholesterol is a little high. So yes, plaques are quite important.
You mentioned something. You don't have the same effect as the originality. I used to say that the flash was very, you never seen it, but it was really, really. So I think that the one is the original is really, it's like original.
Good question. I'll answer the last one first. So, I do not see, but I can certainly taste. So, I do not want to see, to be honest with you, because I'm afraid to know. It should be.
We haven't heard the question. Let us know what the question was.
So the question was, what is the salt within the fat? When you go to a fast food restaurant, what is actually salt content in the food? I can't really say, but I can taste, as I said, and it is high. It is very high. And I do not want to say because their aim is to make money. Okay? The first question, can you repeat it for me?
Well, that's the effects of marijuana smoking is the same. And the other question, who is to say that the manufacturers who produce a lot of stuff in the are giving food ingredients away?
There's nothing to decipher, but there is a Food Drug Association that actually monitors these things. So things need to be approved by them first before they actually come out. So they're kind of monitored. And the accuracy of it is actually monitored as well. Now, the question before was, does marijuana affect you as much as tobacco within the smoke? And this answer is going to be two-sided, two-folded. So one, in terms of causing your blood pressure to be high, marijuana may actually lower your blood pressure. Believe it or not. Marijuana is actually a relaxant, so it will lower your blood pressure. But there is a but. The but is that it can affect you other ways. So, yes, it may not affect you in terms of affecting the arteries in the body, but it can affect your lungs. So the tobacco in smoke, say it affects your lungs the marijuana in the smoke affects your lungs probably 5 times as much as tobacco will affect your lungs. So there is a downside with that regards when it comes to marijuana.
If you eat and you will think almost immediately, what effect that has?
Right, so MSG actually has a lot of sodium in it, and therefore it should also be avoided. It's one of those food additives that should be avoided. Yes, it's a preservative, but it is very, very high in sodium, so it should be avoided. And then your next question was going to sleep immediately after eating. No, your digestive system is a very strange thing. When you eat, it starts to work over time. And it actually requires a lot of energy to digest your food. So you eat something, your digestive system starts to digest the food that you eat. If you go to sleep immediately, the heart and the digestive system are going to be overworking during the time that you are sleeping, and that is not good. If you can't help it, then that's just one, but try not to eat just before you sleep. That's not good. I think we just okay, one more question. Just give this lady over her a chance.
So is there recommended about time to eat during the day, for example, 6 p.m., 7 p.m., 3 p.m.?
Right. That's kind of hard to answer because there's some people who actually work some shift systems and they may be up at a certain time. And obviously you're going to need energy, you're going to need food to be able to do the requirements that you need because your food provides you with energy. If you have no energy, you can't do anything. So it's hard to say what a cutoff is like. But if you have 8 to 4 days, usually, so you go work at 8 o'clock and you get home at 4 p.m., I think your cutoff for eating should be no later than 8 p.m., especially if you're going to go to bed by 10. So you need to actually give your system at least 2 hours before you actually go to bed. So if you're going to go to bed, your cutoff is 8, your cutoff should be 6. That's my recommendation.
Dr. Morris, you mentioned that stress is a major contributing factor, but there are other people who work in stress-related jobs, who live in stress-related environment, and because of the economic conditions prevalent in Barbados, there's a lot of stress. Are we to conclude that we can do very little about this hypertension situation?
No. Well, yes. Everybody is stressed. And that's the thing that we will not be able to control. I'm stressed, Father Rogers is stressed. Many of you are in stressful environments. You have to work over time. Your boss is working you like what? there's something you can do about relieving stress. And that's what you have to do in order to decrease the amount of stress. So the gentleman behind there, I don't know his name, he mentioned meditation. So meditation is one of those things you can actually do to actually relieve stress. And exercise is also a stress reliever as well. Listening to music is a stress reliever. Doing things personally that you like to make you feel relaxed are stress relievers. So continue to relax every day. So do something every day to relax and to relieve your stress.
Ladies and gentlemen, all good things must come from me. And by your response, I'm sure you enjoy the talk, the lecture, and you have a lot of questions. Somebody said she must come back again. But really, on behalf of Reverend Rogers and the entire church, we want to thank Dr. Morris, who is a member of this church, for coming and giving us a very informative lecture. And we know that others, we have another doctor here, and from time to time, he will come and give us a bit of knowledge and the training. Let's give her a round of applause.
This is actually my first lecture to a non-medical group, so I am so proud to make my statement. Thank you very much.
You will notice she has some words of advice for Reverend Rogers. Rogers.
I just wish to thank Dr. Morris, as Mr. Walton said, for the wonderful lecture. Very informative. She had some things there that I'll ask her about after. Like drinking tea and so on 5 and 6 times a day.